Thank you very much for joining us. Welcome to the webinar on remaining vigilant, staying healthy, and keeping calm in the face of coronavirus, coordinated and sponsored by the Jewish Education Project in partnership with UJA-Federation of New York, Prizmah, the American Jewish Committee, OHEL Family Services, and JCRC. We thank everyone for joining us on such short notice, and most especially our expert panelists, whom we will introduce in just a few moments. Together, we are navigating the facts around the coronavirus as they emerge. It is our goal to be a partner with each of you in supporting a prepared and effective response for your parents, children, and faculty. Through thoughtful engagement with knowledgeable experts, we can effectively guide our communities at this time. My name is Sara Seligson, and I am the Managing Director of Yeshivot and Day Schools at the Jewish Education Project. We are joined today by Marc Stern, General Counsel of the American Jewish Committee, Dr. Norman Blumenthal, Director of Trauma, Bereavement, and Crisis Response Team at OHEL Family Services, and Dr. Sharon Nachman of the Department of Pediatrics at SUNY Stony Brook. Each of our presenters will present for approximately 10 minutes, after which there will be another 10 minutes of Q&A before we move on to the next topic in today's webinar. Let's get started. I'm going to turn to Marc from the American Jewish Committee to please share his thoughts with us on the legal responsibilities schools should be thinking about vis-a-vis the coronavirus exposure. Marc, please.
Ideally, this would have begun with our medical expert, because the medical facts, in fact, control the legal duties. They define them and delimit them, but I have a prior commitment that I can't escape. So I'm beginning somewhat out of order. Look, if the question is, what can you do to absolutely immunize yourself from a lawsuit, the answer is nothing. Anybody with a filing fee can file a lawsuit at any time. If the question you're asking is, what can we do, A, to protect our students, but B, to ensure that we're not successfully sued, there are very important things to do and standards to keep in mind, and I think you'll be fine if you do those things. As a general rule, schools owe a duty to students to provide a safe environment. That's not an insurer's duty. You're not absolutely required to prevent accidents. You're not required, for example, to run recess in a way that makes sure that nobody ever scrapes their knee or breaks a bone, for that matter. You're required to take reasonable steps, not to be negligent. You owe that duty to your students to take reasonable steps to keep them safe and healthy. You're not obligated to guarantee that they won't get sick or hurt themselves. That's an impossible standard. The law doesn't impose it. There is not a whole lot of case law on your duty to prevent infections from spreading. I found one case. Kid was wrestling. An alumni came in. The coach said, "Wrestle with our alumni." The coach knew or should have known that the alumni had herpes. They wrestled. The plaintiff caught the disease from the volunteer, and the court said that might be negligent. But the court said mere casual contact with a disease doesn't create any liability on the part of the school. So I would suggest to you that applying that to coronavirus means that the fact that somebody gets sick in your school is not enough alone to state a cause of action for negligence, even though I can certainly foresee that there will be parents who will bring such cases. Now the question is, at what point does it become unreasonable to allow even casual contact amongst children who can spread the disease? That depends very much on what the biological and medical facts are. How easily does the disease spread? How close was the contact one student had with another? Apparently, from what I've read in newspaper reports, the SAR student who got sick, and we've all read about, was the child of somebody who, in fact, has now been confirmed to have coronavirus. Does that Does that mean that the schools are now required to close down because there was a past exposure? The answer to that is a medical question, not a legal question. And therefore, if I were asked by any particular school what to do in that circumstance, it would be, if the question is, do we open, do we quarantine all our students and the like, the answer is it depends on what health authorities are doing. And what I would do in that circumstance, if I were presented with it, is get a written record of an inquiry with the Department of Health. Should we open? These are the facts. Should we close? What should we do? Should we close for a day and disinfect the building? And whatever the guidance of the Department of Health is going to be, if you comply with that, I think you'll be on pretty safe grounds. There is, I think you may have seen it already, the CDC, Centers for Disease Control, has a guidance on what schools should be doing. If you haven't read it, you should. That will establish a standard of care. You will not be required to guess on what tomorrow's news is going to be. If you follow the CDC recommendations, you'll be fine. They're fairly obvious. Encourage hand washing amongst kids. If you can find it, get hand disinfected and scattered around the schools. For younger kids, I would have them wash their hands once or twice a day under the supervision of teachers. I would also have the cleaning staff after hours, this is one of the recommendations you're seeing, is wipe down with a bleach or some other disinfectant, door handles, things that people touch a lot in the course of the day. Those will minimize your risks as well. Whether they will, in the end, whether any of this is effective, only time will tell. But the question is not, again, whether you can absolutely prevent the disease from spreading. The legal question is whether you've taken reasonable steps. If you're following the latest advice from the CDC and the Department of Health, you will be fine legally. I should point out that you owe two duties. You owe a duty to students, and you owe a duty to teachers and other employees who are workers. And their federal and state laws require you to provide a safe workspace for employees. And so all these health precautions, cleaning, disinfecting, we'll talk about excluding students in a moment, all of those are not only to prevent you from being sued by angry parents, but also to protect you from charges that you've not protected your employees. Again, no reason for panic here. You follow the CDC, New York State Department of Health protocols, you'll be fine. The state has said, by the way, that in the next day or two, they're going to publish protocols for disinfecting schools. Those will probably be legally binding only on the public schools, but a private school would be well advised to follow those guidelines. And well, that means your cleaning staff maybe should spend less time straightening desks after hours and more time disinfecting for the next few weeks. You should have tissues scattered around the building so students can easily access them. All of those are sort of common sense things. They're listed in the CDC, Department of Health precautions. You ought to make sure that they're done. You ought to be talking to students about basic hygiene practices, particularly as they affect schools. You'll see in these guidances, and you should put those into place. Now the question is, what do you do with sick students? And this is going to be very hard. Again, I will defer and change my advice if the medical advice is different, but this is going to be very hard. Anybody who's ever seen young kids know that sniffles are endemic, for instance, to the younger grades almost all winter. Well, the advice you're getting is people who feel sick, who meet certain criteria, fever, colds, and so on, they're coughing a lot, ought to be encouraged to stay home. And you ought to amend, if necessary, your attendance policies to encourage people to stay home when they're sick, and not, as some schools do. There was concern with people who go to, who are interested in admissions to elite schools, that if there are a lot of absences on their records, they'll be denied admission going forward. Those policies need to be changed. If you have such a policy, you're encouraging people to come to school when they're sick. You don't need to do that. On the contrary, What you need to do now is encourage people to stay home when they don't feel or when they're coughing and the like. If somebody comes to school and gets sick in the middle of the day, you need to isolate that student and ask the parents to remove them. Remember, there's a duty to school nurses and teachers. So you may have to, the nurses presumably will know the appropriate medical protocols. Kids should be kept isolated from other students and to the extent possible from adults. And then you need to keep up with the students and to find out if in fact they have this virus, and if it is detected in your school population, to follow the advice of public health authorities as to what comes next. You close the school. I'm talking strictly legally. I understand you're going to have parents down your neck that if you have anybody with coronavirus from 3 degrees of removal, to close the whole school forever. Legally, you're under no obligation to do that. You follow the advice of public health authorities, and somebody in the school needs to be charged with keeping up with that pretty much on a day-to-day basis, because that's how fast the advice is changing. I think that pretty much covers everything I want to say, at least at the beginning. I'm happy to answer questions, and if there are questions later, Judith can get you my email address and I'll do my best to answer them.
Thank you. We actually already have a few questions that have come in prior to the webinar and while you were speaking. One was regarding teachers who might be ill but are refusing to go home. What is within the school's purview to do in that situation, whether it's teachers who are refusing to leave or parents who are insisting their children are not ill?
Certainly in the case of private schools, it's entirely up to the school. In the case of teachers, I would tell them, take the day off. We're not going to dock you pay. If your kids don't know, every pasuk or every scientific formula at the end of the year because you took a day off, we will all live to, to teach another day. There is a martyrdom complex. I'm married to a teacher and principal, so I have some idea about this. There is sometimes a martyrdom complex. It's not justified, and you should certainly send the teachers home. I remember that New York City and New York State have mandatory sick leave laws, which you need to comply with. Yeshivas are not always so good about those things. But you should send them home and with pay, because otherwise you're encouraging teachers to come in sick. We have tentatively made a decision here at work that if people are quarantined, and the governor is going to propose this, but we've decided already that if people are going to be quarantined or are afraid to come in, we're not going to hit the full load of sick leave days that they've accumulated, because people will be reluctant to do that. People just given birth and have used up their sick days. We are going to make it possible for people to choose to stay home when they don't feel well. The same thing is true of students. So if you give awards for attendance, for example, you need to carve out people who stay home for coronavirus. It may defeat your one purpose, but it'll keep the rest of your school healthy.
And regarding release forms and the capacity to screen teachers and parents, I guess screening for coronavirus, are there any sorts of forms that exist already?
No, they would be the general rules. This gets a little bit tricky because of HIPAA, that is the privacy rules. If you send a teacher home because they're sick, you should not announce that they have coronavirus. If they have coronavirus and they tell you, you should not tell anybody the teacher's sick. Let people can speculate as they wish. I mean, there are a whole variety of laws you have to deal with. If you're screening generally in your population because the health authorities have urged you to do that, then I don't think you need to worry very much about forms. There should be no physical contact. It's basically a thermometer, as I gather, and I wouldn't worry about that. Again, follow exactly the advice of health authorities. On the other hand, and this is hard advice to hear, and I don't have the burden of responding to hysterical parents, there's no reason, if you have an entirely healthy population, as far as I can tell now, to routinely screen everybody for temperature or colds or something like that. but people should be watchful if particularly younger students and teenagers who will not, who will be heroes, to point out that they're not feeling well and to impose segregation if that's appropriate. But I don't see at this point any need for mass screenings in a regular population. Again, subject to the doctor's confirmation.
Of course. And one last question. This might be outside of your purview, but I'm going to give it a shot. If schools are closed for extended periods of time, that old question of parents requesting tuition reimbursement or remission, I'm assuming that schools must have something in their tuition contracts. Is this something that you know anything about, how a school might navigate?
I mean, I know general contract principles, and I would think that, first of all, it never astounds me how ungrateful people can be. The school will be, if it closes because public health authorities force it to, generally there's a concept of force majeure, overwhelming force, tornadoes, hurricanes, and so on, which excuses compliance with contracts. I don't think most courts are going to pay any attention to a claim like that. On the contrary, first of all, if you're told to close by public health authorities, it's not that you've done anything. In any event, I am sure that the school authorities will be providing, because there's a 180-day requirement in New York State, these differ from state to state, people are going to have to make up school days in any event. If you want your kids to pass the Regents and you're closed for 2-3 weeks in March or April, you're going to have to reschedule the time. Basically, my attitude would be, tell them, no, we did this for your benefit and your kids' benefit, even if you weren't sick and your child wasn't sick. Public health authorities told us to do it or advised us to do this, and we're not giving you back any money. I thought the question would be a different one. Are you obligated to provide distance learning by phone, by Zoom, the way we're doing this phone call? That's a more interesting, with excuses that's a more interesting question. We had something similar in the measles epidemic. If somebody wasn't vaccinated, did the schools owe them distance learning? And although my advice was that schools should do that, this is before New York repealed the exemption, many schools were not willing to undertake that obligation. It's complicated, particularly if teachers are not in a central location. How are you going to do it? But it's worth thinking about as an alternative.
Thank you so much. I know that you need to hop off because you have another commitment.
Right.
Thank you for your time and your expertise. We will be sharing your email with people if they have follow-up questions. Thank you so much.
All right, I'm not getting off because I don't value my colleagues.
We are so appreciative how you carved out the time today. Everyone should know this was very last minute that all of our panelists agreed to speak. Thank you so much.
Thank you.
And now we are going to shift over to Dr. Blumenthal, who is going to speak about more the emotional and psychological lens. I'm just going to say one more thing about questions. Lots of questions have been posted that are more on the medical side. We are going to save those, and after Dr. Nachman speaks, we will address those questions. So no worries about your questions.
Okay, thank you very much, Judy, and thanks to everybody at the Jewish Education Project for the Herculean job of putting this together on such short notice. It's a very important service to the education community and to the community at large. What I'm going to focus on is how to communicate this in an effective way to children from mostly a teacher's perspective, although I will also address parents, because obviously that all has to be very coordinated and consistent. The overall goal, I guess if you're the type of person who reads the last page of a whodunit before you start the book, the goal is to try to juggle precaution without creating alarm. I think that's warranted in terms of the extent of the danger that exists, that we have to implement a certain amount of precaution, but I don't think we're at a place where we have to be alarmed ourselves, and certainly not impart any kind of alarm to children. We have to keep the perspective of what percentage of the population is afflicted and what percentage of the population is in actual danger of being compromised significantly or possibly dying from this virus, and give over the sense of urgency that is commensurate with the actual risk that exists. So first of all, a very big part of this, besides giving over that information and making sure the information is factual, and let me say that in today's day and age of the internet and social media, etc., the perspective is very important. Hearing about it again and again, seeing very vivid images, potentially hysterical exchanges on social media, or the fact that just about anybody can post anything, and sometimes what's posted is not accurate. It's very important that we give over to our children and to our students a realistic perspective of what's going on. And again, our job also, which is very important as teachers and adults, is to teach now maybe new standards, higher standards of hygiene and precaution. And again, to do that without creating a panic. Very important whenever this is happening, and particularly to very young children, is to be especially cognizant of your voice tone and your body language, perhaps even more so than the particular words you use. Scared children are listening to how we say something, often more times than the actual words we're using. And as we teach hygiene, and as we try to give this perspective on the illness, we have to say it with a certain amount of certainty, with a calmness. And I would even say that if you yourself are somewhat panicked, or if you yourself are maybe disproportionately worried, that you may have to address that first, a little bit like what they say in the airplane, let's say put the oxygen on yourself first, that you need to address that to get your response to be in tandem with the level of risk that actually exists. And if for some reason you can't, either because perhaps you yourself are prone to anxiety, or you have a history, or maybe you have some close connection to someone who is more profoundly affected, then maybe you're not the person who should be giving over this message, and you should probably then punt to someone else who will convey these messages. And you never fool children. If you are yourself somehow derailed by this, don't think you can fake an act. Nobody reads adults better than children. So again, make sure you have that proper perspective before you try to give it over to the children. With very young children, it's important to teach, and it becomes even all the more important because I don't have to tell you how much children will touch their face, will suck their fingers, will put their fingers up their nose, and all the other kind of things that children kind of do routinely. It's important to teach them this type of hygiene, and probably in a gentle, more playful way. If you have a mnemonic, if you have a song, if you can do it in the context, if you can give it over in the context of a story or a storybook with pictures, that's going to be remembered more and taught and then reinforced periodically. And of course, praise is extremely important. The younger the child, the more they want to please the adults and the more they want to please the teacher. And when someone properly washes after going to the bathroom, or blows their nose with a tissue instead of their hand or finger or something like that, the praise from the teacher is very important and very much valued, and can then be more readily integrated into their habits and to their routine. Older children can be explained in a more traditional fashion, again, giving them the proper perspective. And something else that's important to note is that children, generally speaking, under the age of 6, don't really know the concept of rare. When you tell them that this is something that's relatively rare, their whole world is about 3 blocks long. So that's not going to help them. You just, I don't think I wouldn't get into that with them. I just say, this is what we're doing now. I mean, the benefit you have is the younger the child, the more they're used to adults telling them all sorts of things that make no sense to them, and they're going along with it. So we just give them the instruction without the explanation. Once a child is in formal schooling, around 6 and older, and again, we can't, there's not exact cutoff. Once the child is in formal schooling, then we can already explain to them that it's rare. We can explain to them what the reality is and why we're doing the various things, why we're making these kinds of suggestions, and help them integrate some more caution into their daily routine and some more of the hygienic types of practices into their routine, again with intermittent and periodic reminders. Obviously, with teenagers, you probably don't even have to explain it. They're probably being knowledgeable. This would probably be the age where you have to do a little bit more warning about some of the hysteria that might take place on the media, on social media, etc., or being careful that whatever they read up on, that they should read up on it at responsible sites. I would urge avoiding suggestions that this is some sort of divine punishment or that there are distinct culprits. I know some of this is bandied about in the news. I'm not sure if that's really important in terms of what we're trying to accomplish. And again, teens would be more prone to try to sort of fuse some of this news and this development in a maybe broader, either theological or political context. It's important to tailor the information that you're giving over to the nature of the child. Obviously, a very anxious child would not need as many reminders. In fact, might need some more of that sort of soothing and perspective taking than non-anxious. On the other hand, the kid who's very not anxious is the kind of the classical daredevil, or the type of child who doesn't let things bother him. This is the child whom you may have to impart more concern and fear because they don't naturally go there. And also impulsive children, your ADHD kind of child or any other kind of dysregulated child who acts and doesn't think will have a harder time getting used to some of the precautionary measures that we have to take in terms of cleaning, disinfecting, or using hand sanitizers, or touching their face only with tissue or something of that sort, and not sneezing in such a fashion that they're surrounded by a whole bunch of other children at the time. So those, again, then there might have to be more of an habit-forming reinforcement with those types of children. Obviously, what's happened in a child's life is going to have bearing on how they're going to respond. Any child whose family is currently struggling with a disease or illness, and it could be unrelated to coronavirus, but if there is illness in the family, a history of illness in the family, or if they know somebody or if it's close to home, then they're going to have more of an adverse reaction, or for that matter, sometimes even a child who's generally having some sort of history of trauma or a current destabilizing event will be affected by that all the more. When we talk about the mathematics of trauma, that 2 + 2 doesn't equal 4, 2 + 2 = 8. So on the heels of some other concerns, this new concern that's existing may be amplified. They may respond in a very strong fashion. Now, if children are home because they're in one of the schools that have closed down, or if they're in the future, there are other schools that may have to close down, it's very important to preserve the routine as much as possible. It was mentioned earlier, Sara mentioned that about the possibility of doing class lessons through the media. That would be ideal, but if not, to try to make that time home school-like. Children are comforted, as are adults, by routine. So as much as possible to preserve the routine in terms of homework, lessons, reviews, and I think schools will probably do that. Even if they can't do it through the video, at least they will send home assignments or etc. And as much as you can make the child feel like we're continuing your education, continuing your schooling until you can resume, or in general, maintaining your routine, and keep them busy during the day. Free time, idle time will lend itself to more panic. And therefore, even if you don't have schooling, try to give the child some activities to do. Sometimes hard with both parents working, but as much as you can, whether it's even a fun book to read and write up a summary of it, or some sort of more educational game or something like that would be helpful, but try to avoid the idle time. Again, very important, consistency is very important. Children are comforted when they get consistent messages between adults, and they're more panic-stricken when they're getting alternative messages between adults. If you're working within a school and the school has a particular way in which they are communicating to the children, please share that with the parents and make sure that try as much as we can, until as much as it's under control, that the messages that we're giving, that the school's giving the child, is all consistent with the more or less consistent the messages the parents are giving the child. It doesn't have to be an exact replication. Children can tolerate a certain amount of differences, but if in some way they're contradictory in any way or radically different, that'll cause more alarm. But again, let's just remember that we're trying to exercise precaution commensurate with the reality of the threat, and hopefully we'll address this health crisis, or let's say health threat, until, God willing, it will be passed. I'm available, and OHEL is available for anybody who has any particular questions. My email address is norman_blumenthal@ohelfamily.org, or you can call OHEL at 800-603-6435 or 800-603-OHEL and ask to speak to a member of the trauma team, and we'll be more than happy to help. I hope that was helpful.
Thank you so much. One comment before I ask some of the questions.
Sure.
Just to clarify, in the future, we will be collecting or convening again in the future to provide resources around distance learning and to support schools on the educational front. And I appreciate that both you and Marc raised that question. And in terms of questions here, you focused primarily on students, which is sort of the obvious approach. There are some questions around adults and what schools or school leaders can do to help the teachers remain calm and discuss this in a calm way with their students, and what are strategies that you think might work for teachers?
Okay, so first of all, I think the factual information is going to be important. We have to separate hysteria from fact. And again, I said in today's day and age, that's a little bit more challenging because of the plethora of information that's readily available and how it can be repeated and reiterated again and again. So we need to give over factual information. I think the administrators of the school have to be very much like how we're recommending the teachers should be, to be very clear. We're taking this seriously. We're not being neglectful. This is not something we're just, being dismissive about. But on the other hand, though, this is not a level of panic. So we're taking, and I think it's very important to spell out very specific, concrete things that are being done in terms of what was mentioned earlier by Marc, in terms of cleaning up the school and disinfecting and that kind of focus, to being in contact with the actual experts, with the CDC, and so that all responsible action is being taken. And to invite the teachers, to give the teachers a place or a person or a contact to go to if they have any particular concern. So it's not just being bandied about that one teacher's going to one administrator, another teacher's going to another administrator. Probably the more organized and orchestrated it is, the calmer will be the response. And I think designating perhaps a particular point person for this matter for the teachers would be helpful in that regard as well.
Thank you so much. Very helpful and thoughtful. And again, we will be sharing your contact information with all of the participants. Thank you very much. Feel welcome to stay on the call.
I will.
You also have some.
Okay.
If you need to, you should leave as well.
Okay, I don't have to. Thank you.
Just another point, we have a number of questions that have come up that are quite factual and that appear in the CDC and the New York State and New York City links. We're not going to address those questions. If your question is very specific, you should really follow up on the resources and the links we're sending, and we will find the best way to communicate that to you. For now, we're going to segue over to Dr. Sharon Nachman. Can you hear me?
So good afternoon, everyone, and thank you for inviting me. I thought I'd spend a few minutes first giving you a little bit of background about how infectious and how sick and who gets the sickest. So the first is, from the data that we have from China, children seem to be relatively spared from either getting sick, they're asymptomatic carriers, and amongst those who are getting sick, getting ill enough to go into the hospital. So the good news for those of you who are teaching children, from pretty much 4 weeks of age through about 15 years of age, the data from China does not suggest that those children will wind up being the sickest patients admitted to the hospital. So that's good news. The bad news is, often, like influenza, those children are going to be contagious. We won't know they're sick They will have no fever. They will look well, feel well, yet they are infected with the virus and can easily transmit it. Let me circle back to that by saying at this point, there is no plans from anybody to screen children in any kind of large-scale screening every day and say, you're contagious, you're not contagious, you can go to school, you cannot go to school. So while the children will look well, they may be in fact contagious and we won't know it. So that's sort of a double-edged sword. We can't prevent them from leaving the house, prevent them from going to school, but we don't know who they will actually infect. On the other hand, they won't get sick. The second is I wanted to make you think for a few minutes about influenza. As you know, we track the flu epidemic every year. We know when it starts, how long it takes to ramp up speed. We know how long it takes to bloom and then how long it takes to come down. Coronavirus is a respiratory virus similar to influenza, different family, but same kind of idea, so that we know from the very first few cases we see in a population that is at risk, how long it's going to take until everyone in that population, in fact, gets infected with this virus. So while we're seeing the first few cases in New York and perhaps sporadically across the United States, we know that it's going to take a couple of weeks now until it's going to get a good toehold into the population, and then we're going to see the huge bloom of everybody getting sick all across the board. So when I hear that schools have closed for a day here or a day there, I'm quite cautious in my thinking that that's going to make a difference. In fact, it won't make a difference at all. Well, let's just close the school at that point, perhaps to get some of the kids who are close contact of the individual who is sick screened and controlled, but it won't make a big difference for the school as a whole because the bloom has not hit New York. So if you're thinking that that 1 or 2 sporadic school days of closing is going to help, it's actually not going to help at all. And if you ask me when do I think we'll see the bloom in New York, I suspect it's going to take another few weeks until we actually see the bloom here. So I'm not so much worried about Purim and a lot of people being in close contact, but if you ask me about Pesach, I think that's when we're actually going to see the bloom of many people getting sick. So asking questions about should we cancel Purim, no, I think the answer at this time is we have no data in New York at this point to suggest that there are enough cases in our environment that it's going to be transmitted quickly throughout a population, but rather we're going to need enough cases, and that's going to take another few weeks, and then it's going to probably hit around Pesach time. Yes, that's sort of good news, bad news. The next question is quarantining and how long is someone considered infectious? At this point, we are thinking that it's about 2 weeks that you may be infectious. You're probably infectious early on when you're sickest, and probably less infectious later when you're less sick. Do we have good data in the U.S. to support it? No, because the data that we're looking at for infectiousness is based on China data, as well as some Italian data, as well as some of the cruise line data. And that's where the number of 2 weeks contagious came up. But we really don't have great data day by day by day to say you're twice as infectious, 5 times as infectious, 10 times as infectious. However, modeling it again on influenza, when you are the sickest earliest during your illness, that's when you're the highest contagious, and it's probably the same with this coronavirus. So I think that 2 weeks is the contagion period. You're probably most efficient at transmitting infection early on, much less efficient at transmitting infection later on. So we are going to see multiple blooms over the next several weeks to perhaps months of going through schools, age groups, communities at any given time, and there's not going to be a time that you could say, oh, we're finished, or anything like that. Why do we say you're finished? No, you're not going to say, you can't say you're going to be finished, because we have an entire population that is at risk for this infection. Unlike influenza, where some people have seen that variety of flu in the past, no one has seen this coronavirus in the past. So we are essentially all at risk for acquiring this infection. The next question that I see often, I get asked often, is what to do with a family who has someone who has respiratory illness. I think the first thing that we need to think about is, have they come into contact with travel? Unfortunately, now because it's starting to hit different populations in the United States, that idea of you didn't see someone who traveled, you're not at risk, is probably going to go a bit by the wayside. However, if you do know someone in the family who is sick, the first thing I would ask them, have they been flu tested? because at this point right now in New York State, if you have respiratory symptoms, it is much more likely that you have influenza than you have coronavirus. Influenza can be rapid tested at any of our walk-in facilities. I wouldn't go there right away. I would say, I'm calling, I'm coming with respiratory symptoms, get a mask, walk in, get tested, and if your test is negative or positive, then we know what to do with you afterwards. So I think anyone who comes in who's sick, get flu tested first, get that ruled in and ruled out, and then we'll go on to sort of the next item of choice, which would be the coronavirus. So that's sort of the other ones. I guess the next thing to remind everyone about cleaning rooms and stuff like that, as the CDC guidance say, we'd like you to clean the things that everybody touches. Not because the touch is infectious, it's because you touch your face after you touch the doorknob. You don't just open the doorknob, you often touch your face, your hands, etc., and that's how the virus is transmitted. So by cleaning doorknobs and things people handle, because those are the things they handle and then touch their faces, we hope that that will cut down on infection. On the other hand, coronavirus is not such a super strong virus. It's a little bit wimpy, and it doesn't sit around on surfaces. So if you didn't clean every single desk in the classroom, that's not going to make a difference, because by the time the class comes in the next day, it's probably not live virus anymore. So someone else touching that desk is probably less likely. Because doorknobs are touched by so many people all the time, it makes more sense to clean those areas. But cleaning lockers and the walls in the offices, probably not so helpful, because people aren't repeated touching those areas. So if you had to pick something to focus on, you want every place that multiple people are touching all the time as the focus of the cleaning and not the walls in the gym. So that's sort of the few things I wanted to talk about. I guess the other big thing to talk about that you've heard the other two speakers this afternoon is with regards to panic. This is a respiratory illness. The people in the United States are lucky to live in the U.S. because we know how to handle people who get sick with respiratory illnesses. We have a great hospital system here. We have IVs, we have ventilators, we have heating in our building. I don't know how many of you look at the China news, but when you look at the hospitals where the patients were in that died, you'll recognize that every doctor walking in that hospital is wearing a white coat. Underneath their white coat is their winter coat. The reason they're wearing the winter coat is the hospitals in China are not heated. So comparing our state-of-the-art of medical care in the U.S. to state-of-the-art of care in China should not be done. So the death rates that we're seeing in China is because it's a very different population of patients that are getting sick in China, and it's a very different state of medical care in China compared to the U.S. So yes, we will see patients who are sick. Yes, they will get admitted to the hospital. They will be in isolation. On the other hand, our hospitals are heated. We have IV fluids. We have oxygen. We have everything at our fingertips. So we do not anticipate the death rate to be anything close to the death rate in China. And among those that died in China, again, for the most part, a lot of them had comorbidities, other underlying illnesses. Those same illnesses in the United States are also well cared for. When you think of parents and grandparents that are diabetics, in China, they have one type of insulin, take it or leave it. In the US, we have 15 types of insulin and multiple other ways to treat our diabetics. They are, for the most part, healthier at baseline compared to those in China. So again, when you think about death rates, and the only number we have to look at is the death rate of those in China, we need to take a step back and say, we are healthier, our hospitals are well positioned to care for our patients, and we know what we're looking for. So all of those together are something we have to take into reducing the panic amongst our parents, our teachers, and the people we are talking to. So I'm going to stop there for a few minutes and try to answer some questions.
Thank you so much. There are lots of questions. We're going to try to get through as many as possible. The question being asked with the most frequency, you sort of hinted to it before, is regarding Pesach and school trips to Israel. How can schools make that decision about school trips? That's part one of the question. School trips that are planned for around April to go to Israel and or Poland. And the other part of the question is, if the bloom will be in different in the New York area, and we'll get to other areas, the question about other areas later, what should schools do post-Pesach in terms of greeting everyone who's traveled?
So those are all great questions, and unfortunately, I don't have hard, fast answers that I can say with a good degree of data as to what we should do. I can just best guess as to when the bloom will hit. I think the CDC is tracking it, as well as Hopkins University is tracking the epidemic, and I suspect a lot of New York State Department of Health institutions will also track the epidemic, so we'll have a better idea when the bloom will hit. I think we have to also balance who's going on the trip, who they're seeing in Israel, what they're going to be doing. Right now, Israel has a good handle on their epidemic that is happening very locally. Those patients are isolated. They're not seeing a bloom in Israel. They may, like us, start seeing that because they also have people coming in back and forth from other parts of the world that they may or may not know that they're infection. So I think all we can do right now is say the trip is on, but we're continuing to watch it. Every day and every week that we get a little closer, we will have more information. To tell you right now to cancel the trip may be overly cautious, and you could do that. On the other hand, you have to balance the needs and the wants of the population with how risk averse are they to traveling at that time. So the answer is, I think it is possible you will have to cancel those trips, but I can't tell you with a good degree of certainty right now that you definitely have to cancel it. It depends when our bloom is going to hit, when the bloom in Israel will hit, and how careful people are, or not so careful, are wanting to be traveling back during that time. I think for those families that are traveling to Europe for Passover, I think they probably have to be a little more cautious than those who are traveling to Israel, because it looks like the bloom in Europe is probably going to hit a little bit faster than the bloom is hitting in Israel, because it's multiple countries trying to contain it with somewhat different rules in each country. So because they're not all tracking together, you may see different blooms. We see certainly a bloom now that's happening in Italy. How well they are containing it, we'll only know in the next 2 weeks, because again, that 14 days of contagiousness is really going to be how we can tell when the bloom will hit. So it's really difficult for me to say, go ahead with the trip or cancel the trip, but it's more important to say, with an abundance of caution, what is the best thing that you want to do for those kids? How necessary is it? Can it be put off? And in the big scheme of things, you know, is it better to keep those kids safe and at home at this time?
Thank you. We have people listening in from outside of the New York area. Obviously, you can't address every area of the United States. Do you have suggestions about how people in different areas outside of New York could access information to understand when the bloom would hit their area?
I think each state, because now the government has allowed for each state's Department of Health to use rapid testing diagnostic kits to check who is infected with coronavirus, we will see a lot of state-to-state information coming through rapidly. In the past, you had to send your sample from your patient to the CDC to get it tested. That, of course, delayed diagnostics in a big way, till you shipped it, till they sent it, till they received it, till they tested it, delayed it. Now, having test kits in every state means we will be much, much quicker about testing someone, and certainly quicker about the answer to someone. Each Department of Health has a website from every state that will be tracking the epidemic. So you can every day pretty much go on the state DOH website and take a look at the numbers of positive versus the numbers screened.
The question has been raised about visiting seniors and senior centers. What should schools do about those sort of chesed trips that they have planned going forward?
So I think right now, because we are relatively low numbers of infections in New York State, I think those trips in the short term can easily be accomplished. I certainly think that any adolescent who's going to be going to a nursing home should be carefully screened. If they are sick at the time, they should for sure not go. I think the nursing homes will certainly not want those kids in the rooms. I think more than that, more than checking when the bloom is hitting and when the nursing homes are going to shut off inviting the students to come in, will be the best way. But I think in the next few days, certainly the next week or so, those students can easily visit.
And in terms of sort of the larger school community, parents and teachers' families, is there anything proactive that schools could or should be doing to track family travel or get a sense of who the parents or teachers are in contact with outside of school time or have screenings?
I think that would be an impossible question. I don't think any school has enough people, boots on the ground, to check every parent, every kid, who visited, who came, who went. I think a notice to all the schools saying that if you have been in contact with one of those high-risk areas, please think about getting screened, talk to your medical provider. That would be nice. But to think that the school should be in charge of every day hearing who's been where, what, and when, it's impossible. When I think about adults taking the subways, well, they didn't come into contact with someone that they knew about, but they rode the subway. So that equals everybody in the world. So there's no limit to how much information is out there that's going to be not useful information for the school. I think a general laid-back kind of comment following the CDC guidance of areas we should avoid, and if you've come into contact with one of the people from that area and they're exhibiting signs and symptoms, or you are, please get tested, would be a better alternative and good use of everyone's time.
Can you speak a little bit, if someone suspects that they have the virus, what is the best and quickest way to be tested?
So I think the best and quickest way would be tested for virus would be going to a hospital emergency room, but calling first to say you're coming in, putting a mask on before you're going in, telling the triage person up front you came into contact with someone who traveled or you yourself traveled and you'd like to get tested. They will put you in isolation and test you. Going to an urgent center or a walk-in clinic is probably not so effective because they may not have the reflex testing capacity and ability. So I think right now emergency rooms are probably a little more better equipped. However, over the next few weeks, that may change when all of these urgent centers or walk-in centers have appropriate screening tools in place to say, we'll swab you, we'll screen you, we'll send you home. The other thing that remember is this is a bit of a changing dynamic over the next few weeks. And until we know if you're well or just slightly your respiratory symptoms, you're better off staying home and not going anywhere versus you're sick and need medical attention because you have a secondary pneumonia. That may also change. So right now, I think if you have signs and symptoms of respiratory illness, but you know that you didn't come into contact with anyone that you know about, you haven't traveled anywhere, and I want to say the rest of your contacts all have influenza, screening for influenza from a walk-in center is appropriate. However, over the next few weeks, as we start seeing the bloom in New York, that may change. If you're asymptomatic, I just wanted to add one thing. If you're completely asymptomatic, we do not at this point recommend anyone be tested.
If a member of the learning community discloses that they have tested positive for corona, what are next steps for the institution?
Is it someone in the institution who's sick or a parent of a child who's sick?
Let's go with a parent.
If it's a parent of a child who's sick, the children should be isolated. They should not be in school, and we'll see how they do. If they're asymptomatic, we probably wouldn't test them. If they're somewhat symptomatic, they would probably recommend to be tested, and they would be isolated for their 14 days and then be coming back to school. Remember, our problem is that we don't know for every adult contact how often a kid who comes into contact with them is going to get sick. We know that it's likely they will get infected, but that's all we know at this time.
And in terms of communication around infection, what is the school's responsibility if a parent is ill? What is the school or the community's responsibility around communicating that and holding the infected person's privacy?
So I don't know that it's the school's responsibility as opposed to it's the adult's responsibility to take care of themselves and take care of their family. I don't think the adult is obligated to tell the school, hey, I have coronavirus, just letting you know. I think right now the HIPAA rules are the HIPAA rules. We can't share medical information. But also remember, if somebody is sick, they could just as easily or more likely have influenza now than they have coronavirus. So I think jumping the gun when hearing someone is home and they're sick and saying, oh my gosh, they have coronavirus, should not happen. I think following their own physician's medical advice is probably the best way to go, and not put the onus on the school to do something about it.
Okay, I think we have covered most of the questions that relate to your expertise.
I just wanted to add one thing, that thinking all of these measures of isolation is going to provide coverage so that our children don't get sick is probably short-sighted. I think that because this is a novel virus and none of us have seen this virus before, the likelihood is that most of us will in fact get this infection. The good news is that kids tend to do incredibly well. We have not also seen data that women who are pregnant are sicker. So pregnant women will also be doing well. The ones who are at most risk to get sick are those that have underlying other illnesses. So is it likely that we'll all wind up in a year from now have been exposed to this infection? Yes. How many of us will get sick? Well, if you look around and see how many of your friends and neighbors got influenza, the numbers will be about the same.
So on that front, there is a question about infection of the virus twice. Is that something that can occur, the same person having a recurrence of coronavirus?
Based on the data we're seeing now from China, and again, our data centers are limited, we have not seen recurrences of coronavirus in those that have had true infection. So there's no reason for us to suspect that that will occur. It occurs with flu because, as you remember, every year influenza serotypes get tweaked a bit. So even if you had the flu last year and you had H1N1 last year, you can still get influenza H1N1 this year because that last year's vanilla and this year's vanilla are just slightly different enough. We don't see that with coronavirus.
And individuals who are immunocompromised or immunosuppressed, could you speak a little bit about their risk and if there are any special arrangements that should be made for students or teachers who fall into those categories?
Unfortunately, we don't have actually any good data on immune compromise because our data from China does not allow us to have any idea. The patients in the U.S. that are immune compromised, for the most part, don't exist in China. So when we see children and adolescents that have had bone marrow transplants or solid organ transplants, or even adults, that population doesn't exist in China. When we think about all of our patients that are immune modulating agents and stuff like that, they also don't exist in China. However, taking influenza as a standard respiratory illness, it is likely that those patients will all get coronavirus and they may be sicker. For those patients who do get coronavirus and are sicker, I defer to their primary care providers or specialists to actually know what's best to do with them. We can't make any kind of broad blanket statements on them. Would I expect you to keep those kids home for the next 3 months? No. I think they, like everyone else, is going to be exposed. Even if we think they're staying home and they're not going to see the virus, they will still see the virus. So excluding them from school doesn't sound reasonable at this point because it's not going to be a 1-day, 2-day, or even 2-week isolation. It will be months until the bloom passes New York.
Thank you so much. You've given us so much to think about and also so much to follow up on in our own research. Great thanks to Dr. Nachman, Dr. Blumenthal, and to Mr. Stern, who had to leave earlier. We really do appreciate all of the information that you've given over. To everyone who's on the call today, we will be sharing out an email with how to access the recording of this webinar. You will have access to links for more resources as we are sharing them as they're updated. We are not creating these resources. These are all resources provided by both federal, state, and local levels. And we encourage you to consistently look at these links and resources so that you can have the most up-to-date information as this conversation continues and as the coronavirus progresses and shifts. Hopefully we can all grow together in health, and we appreciate everyone's participation today.